Dr. Mistry here once again, helping you get ready for your vasectomy. In our practice, we use ties to tie off the vas deferens. And a lot of people come in, they do research online, and they want to know kind of what makes our procedure a little different. And that's certainly one of the differences that we have. There's a technique of a vasectomy called the open-ended vasectomy, where you leave both ends open and you don't tie them off. We do not do that because the end that comes from the testicle, if sperm leaks out of it, you can get something called a sperm granuloma that can be quite painful and tender. So we don't like that. We tie off the end that comes from the testicle with a suture that dissolves on its own. We do this and don't use staples or metal clips because several reasons. Number one is I don't want my patients walking around forever with a little reminder of me, that being a metal clip in their scrotum. They usually get 4 because there's 2 for each vas deferens. And in our clinic, I don't like to bind up anything on the end of the vas deferens that goes up to your prostate and to your penis. And the reason is that I think that the nerve tissue that's there can get entrapped in the clip, and it can cause more pain. I also think that it's a lot easier to use the clips because you don't have to do as fine of a dissection. And by doing that dissection, I think I cause a lot less nerve pain. It's actually one of the main reasons I think that our vasectomy patients have so little pain afterwards and very little risk of long-term pain. We don't want any reminders of the procedure except for just not having any more children. The stitch will dissolve on its own, and then the tube itself scars down. Mainly because I want to limit the pain you have and not have you have to live with a metal clip. That's why we don't use the metal clips. Now, the one downside is that if you're trying to reverse a vasectomy, it's nice to have those clips there to find the 2 ends. But truth is that I've reversed my own vasectomies hundreds of times and not found it to be too much of a big issue. So we look forward to seeing you in the office.